Welcome to GNCC Espresso Live, brought to you in partnership with TD Commercial Banking. My name is Mishka Balsom, and I will be your moderator for the next hour. The purpose of the series is to better understand how COVID-19 has impacted our lives so far and to start thinking about tomorrow. How will this pandemic have changed how we live, how we work, how our societies will function? And how has this impacted our corporate structures, employees and customers, and our business operations overall? How will it reshape our collective priorities? Since launching our webinar series, we have spent much time on looking at the economic impact of COVID-19, the information and subsidies needed, tax and legal implications, municipal consequences, and we have heard from business leaders about the measures that they have taken and put in place to strengthen their business. Today, our focus is shifting to the public health response and the impact on owners, employees, and the community at large. While organizations and governments are responding to the ever-changing pandemic impact, businesses have more and more questions, especially as discussions are prevailing as it comes to moving back to stage 2. To provide us with their expert view, we are joined this morning by Dr. Hirji, the Acting Medical Officer of Health for the Niagara region, appointed to the position in January of 2018. In this capacity, he is responsible for protecting the health of Niagara's 450,000 residents and 15 million visitors through public health programs such as vaccinations, preventing chronic diseases, health inspections, enabling children to get the best start to life, as well as land, ambulance, and dispatch services and emergency planning. Dr. Hirji holds an MD from the University of Calgary and a Master's of Public Health in Epidemiology from the University of Toronto. He completed specialty training through McMaster's University, earning a specialty certificate in public health and preventative medicine from the Royal College of Physicians and Surgeons of Canada. And Chris Gaspar. He started at the region as a public health inspector and continues presently as a manager with environmental health. In this capacity, he is responsible for managing infection prevention control labs investigations in both regulated and unregulated settings, as well as outbreak management within Niagara's long-term care and retirement homes. Chris has a Master's of Education from Brock University in Administration and Leadership in Education with undergrad degrees from the University of Guelph and Ryerson University, along with a certification as a public health inspector. Dr. Hirji and Chris, thank you for being with us this morning. But before we get into today's discussion, let me pass it over to Scott Galbraith, District VP for TD Commercial Banking, providing us with introductory message. Over to you.
Good morning. My name is Scott Galbraith, and I'm the District Vice President for TD Business Banking, covering the Niagara Peninsula. It is our continued pleasure to come to you as the sponsors of the GNCC Espresso series. It's our pleasure to continue to assist in providing valuable information to those of you in the business community and to continue supporting everyone through these uncertain times. We hope you enjoy the content of today's presentation. If you do have concerns or questions about banking or anything related to TD, certainly feel free to reach out to myself or Jennifer Monaco, whose information will be provided at the end of the presentation. Jen is the relationship manager for TD covering the peninsula. Thanks again to Mishka and everyone at the chamber for the invitation to continue to participate, and we hope you enjoy the presentation. Thanks very much.
Thank you very much, Scott, and thank you very much for everyone at TD Commercial Banking for making this morning's webinar possible. It really means a lot to all of us. And thank you to all the participants who have joined us this morning. You are currently on mute, but we really would like to have an interactive dialogue with our panelists. So we encourage you to use two functions that are available to you on Zoom. One of them is a function where you see the symbol of a hand. When you click on it, it actually indicates to us that you would like to be unmuted. We will unmute you and you can ask your question. And the second option is the chat function within Zoom. There you can type in the question that you would like to ask, and we are more than committed to actually ensuring that we can get to all of the questions today, so we can see it on our end and ensure that we have a really robust dialogue this morning. So thank you for being with us this morning. And as I had mentioned, Dr. Hirji and Chris, thank you for being on our panel today. So let's get started. We have had a number of people since promoting this webinar who have also texted us or emailed us or through social media provided us with some of the questions that they have just in case they're not able or weren't able to join us this morning. And one of the first questions, and one that we have seen from a number of participants and attendees, as well as people who have shown great interest in today's webinar, has been the question that is asking, how does Niagara look when compared to the rest of the province? Are we headed for a rollback to stage 2 at any time soon? And Dr. Hirji, if I can maybe move that question over to you, and it's all yours.
Okay, thank you so much, Mishka, and thank you to the GNCC for inviting me and Chris to have the opportunity to speak with you. I totally understand why this question is really a hot topic. I think, it's been a very difficult time for our businesses across Niagara, and the uncertainty of what is going to be the situation going forward, I think, can be quite difficult for all of you. I do think there's a little bit of reassuring news I can provide, but there's unfortunately no certainty going forward. Really, the way we stop an infection like COVID-19 from spreading is we need to break up social interaction. So when two people are interacting closely, of course, infection can spread between them. And by trying to break that up, we prevent that infection from spreading. And through the months of March and April, of course, the province put in place lots and lots of restrictions on social activity, which included allowing certain businesses to function, to really break up those social interactions and slow the spread of infection. And I just want to show you a couple of graphs here. This is looking at what the number of cases were per day in Ontario. And you can see that through the first months of the year, we had a spike, and then those numbers came steadily down. And that's because, the province was successful at breaking up those social interactions and allowing, the infection numbers to come down. Of course, this takes us to the end of July. And at the end of July, the entire province moved into stage 3, where really a lot of social activity was allowed to resume. Most businesses were able to get back up and running. And as you can see, unfortunately, that coincided with the number of cases going back up in the province. And so, one argument that comes from this is that, does this mean that we need to scale back and move back out of stage 3 to stage 2 to perhaps bring those infections back down? Just showing you the Niagara numbers here, a little bit more choppy because we're doing a smaller sample size, so there's going to be more variation. But again, we do see the numbers have gone up. But I think it's notable that you can see that, at the end of that graph in October, the numbers haven't gone up higher than they were back in March and April. Whereas when you go back to the Ontario graph, you probably notice that they are well exceeding those numbers in March and April. So, what I'd say here is that while the numbers are rising elsewhere in the province, necessitating that some regions have had to move back to stage 2, it doesn't seem to be quite as dire here yet in Niagara. We are managing to hold the line, and particularly if you look at this over the last month, while we've had some ups and downs, we sort of seem to have stayed steady at that rate. I'm just going to put one more graph up here, which is really comparing us to a few of our peers. And there's a couple of dotted lines on this graph, and the key one is that second dotted line, the one higher up, which is called provincial threshold for additional measures. And that's what the province is using as kind of their trigger when they start thinking about, does a region need to move into stage 2 because infections are rising too quickly. And this is really showing the number of infections on a per population basis. And so if you look at the start of September, you can see that there's some regions that were starting to rise a little bit. Niagara, we are that solid green line at the very bottom, so not looking too bad. Over the course of September, of course, we all know that some regions spike quite markedly. And you can see the top 3 there, which are Toronto, Peel, and Ottawa, going quite a bit up. And of course, many of us were going up as well. And you can see the solid line for Niagara that we were heading up, though not quite as markedly. What's really happened through the month of October is that you see that top few continue to go up, But if you look at that solid line for Niagara, we have managed to flatten out it, level below that threshold where the province would start to consider stage 2. And so that's, I think, really encouraging news for us for the moment, that we are in relatively safe territory, that we're not really on the province's radar for a region that needs to move back into stage 2. That being said, you can see Hamilton, Halton region, our neighbors are actually above that threshold, not by a lot, but a little bit. And so there's a lot of risk of those infections spreading over to here. And more generally, there's a risk of infection continuing to spread more as we head into winter. And I think the key message is that the way we're going to avoid that from happening is that we need to do voluntary things on our part to break up social interactions, so we don't need to have coercive provincial government rules that do that. So as much as we can about keeping our social circles small, really just to our households, that breaks up social interactions. If we have symptoms of illness, staying home so we're not spreading that illness around, that's going to help keep us safe. Keeping 2 meters distance, washing our hands frequently, wearing face coverings. If we all do all of those things really well, I think we can stay within stage 3. We don't have to see any new restrictions on our society, and we continue the trajectory that we're seeing here, where Niagara's numbers are up, but they're not into a danger zone yet.
Dr. Hirji, thank you so very much. And this is some positive news. There is a follow-up question to your comments that has come through. And one of the questions is, what does stage 2 mean to businesses and schools or other organizations? What are they expecting, or what can they expect at that time? And I'm sure that it's slightly different dependent on the type of business that we're talking about. But if you could maybe on a broad sense give people an idea what to expect in case the numbers do go up, although we all hope that they don't.
Yeah, the way the province has written the regulation, it actually has multiple different categories for different types of business. So it's hard to cover everything. Some of the highlights, though, are schools will continue to operate, which I think is really good news. And one of the good news stories we've seen over the last 2 months is that we don't see a lot of spread of infections within schools. Children, teachers are getting infection outside of school, and that requires others in the school to then be isolated because of the risk of infection having spread to them. But we've seen very few cases actually having spread within schools. So schools do seem like something where we're able to operate safely with the measures in place. A lot of what stage 2 would require is some activities that are happening indoors would really be pushed outdoors. So for example, restaurant dining, no more indoor dining is allowed in stage 2. All dining has to move outdoors, which is of course far more challenging now than it was in the summer, given the weather. Certain activities such as those in gyms, there would be further restrictions on those. So limiting the numbers of people that can be in gyms and the size of classes allowed. Those would be kinds of restrictions that we'd see. There wouldn't be too many businesses that we would be forbidden from operating, but there'll be a lot of additional measures, particularly to reduce numbers in a business, space people out, and actually push some of the activities outdoors.
Yeah. Thank you very much. That type of information is so critical for businesses because I look at a lot of businesses, they're making purchase decisions on the foods, the supplies that they're buying, under the assumption that they are operating as they have been operating over the last couple of months. So any bit of information is really critical at this point.
Yeah,
and
if I may just quickly flag that, I'd encourage everybody to look at Ontario Regulation 364/20. That's 364/20. And I think that would give you some of the rules in place.
Yeah, thank you very much. And I also wanted to let all attendees know that some of the things that we're talking about today and some of the resources we will share with everyone either via our website or follow-up email directly as well. Chris, to bring you into this dialogue, what can businesses do to control the spread of COVID-19 among staff and customers at this time to ensure that we are staying in the stage that we're in and that we're not rolling back to stage 2?
Thanks, Mishka. Thanks for having me today, GNCC. I think what I want to communicate today is that a lot of the same principles that Dr. Hirji has already mentioned can be applied across the board. So you take a look at limiting social gatherings to just your household, staying home when you're ill, even if you have minimal or minor symptoms, and then always assessing who you're around, whether or not they're high-risk individuals. Opt against being around those individuals if they're at higher risk for infection. But when taking a look at businesses and what they can do. There are some key principles around physical distancing, mask usage or face coverings, as well as hand hygiene that are absolutely critical. But at the end of the day, what we are looking for is for employers to encourage staff who are feeling ill to stay home and practice active screening upon going in for the day. That means having someone there that's able to validate or attest to the individual visually as well as verbally that they're well and that they're safe to report for the day and work as intended. At the other end of the equation, where education is absolutely critical. And I think businesses, owners, operators, as well as general managers that are involved on the day-to-day operations need to exercise a number of different options available to them in order to kind of allow that or ensure that their staff are in tune and up to date on everything. So that could be done through the posting of signage. I know that some businesses have produced email blasts on a recurring basis, such as a weekly basis, provided PPE training on how to properly don and doff masks or face shields, as well as even having circle meetings, physically distanced, of course, to have an open platform for question and answers with the staff members that they're working with on a day-to-day basis. I think trying to look at staggered shifts is another key option to limit the number of people that are going to be in the office on a given day. Hold virtual meetings, but of course, if meetings are going to be held within offices, make sure that they're held in rooms that are large enough to accommodate that physical distancing. I know here at the Niagara region, we've applied stickers that are 2 meters apart, if not more, in order to allow for that physical distancing. We've also been monitoring flow throughout the building in order to kind of encourage the physical distancing parameters of 2 meters or more. And I think the other thing would be is to, even though if you're in a setting when you're at work and it's not accessible to the public, think about installing or initiating a policy or a rule where face coverings are mandatory when physical distancing is not possible. Here at the region, we've just recently done that. And whenever you're moving or maneuvering around the office, you do have to don that face mask or that surgical mask. So a number of different items that need to be considered. I would also focus in on the high touch surfaces, and I'm going to get into that later on in the presentation. But cleaning and disinfection is absolutely critical, and knowing how to use the product, when to use the product is extremely important in terms of mitigating the risk to yourself as well as your staff.
Yeah, and I really appreciate, because I think a lot of really the benefits lie in actually the details in every single step that we're taking, and being conscious of the steps that we're taking and that our employees are taking and our customers at the same time. I just wanted to bring the attention to all the attendees that if you do take a look at the chat function, you will see that Dr. Hirji and my colleague Hugo Cheshire both have shared actually the regulations that are in place, which have the specific rules as it relates to stage 2, as well as the ones for stage 3. So if you look at the chat function, you will see it there, and we'll make sure to email it to you as well. Chris, while I have you here, one of the questions has come forward specifically about eat-in dining at restaurants and bars and those specific areas. It's critical for those businesses. They're eager to stay open. The patios are now closed due to weather. Some of them have patio heaters and others to actually accommodate that. All of them are more than committed to following the existing rules and regulations that are there. We have been greatly encouraged by the business community in Niagara in following them. Are there any additional precautions that they could put in place to ensure that we're not rolling back to stage 2?
Thank you again. The same parameters, practice physical distancing for everyone. When you're looking at individuals that are going in as patrons, ensure that you're doing an assessment of your dining area. Ensure the tables, the chairs, etc., are split and separated at least 2 meters apart. And not only that, but take a look at the servers. Can their computers be separated? The line cooks, could they be performing their work within the kitchen, practicing physical distancing? I realize that some kitchens are tight and not large enough to accommodate that, but then utilize face coverings or a face mask. And I know that the Ministry of Labor and Training and Skills Development has also put forward the recommendation for servers to wear face shields. Because typically when a patient goes into the restaurant, what they'll do is they'll take their seat or take their table, they're unmasked to have conversation and to eat. And then the servers are coming less than 2 meters or in contact with the patrons at the table. So that's why that recommendation has been made. So being aware of how to handle and don and doff again the appropriate PPE, clean and disinfect the shield in a proper or appropriate manner, but also being cognizant of how many times you're putting your hands to your face. It's a key item to prevent the potential spread of infection, and being aware of that sort of hidden precaution or the hidden effects attached to that sort of thing that you may not recognize on a day-to-day basis. So I would also assess the lobby, the environment as a whole. Maybe the host can be supplied with a barrier, a perspex or a plexiglass barrier that would help prevent the spread of or help initiate or contact precautions. And the last thing I would say is I saw on the news this morning for outdoor dining, although we're moving into the fall, winter months where it is colder, contact your area municipality and to discuss what options may be available to you. I've seen patio domes come out this morning. I'm not sure what the municipality would say with respect to those, but there are options potentially available to you to accommodate that aspect of things.
Yeah, thank you very much. It's really helpful, and especially helpful to those people that are attending this morning that are running a restaurant or bar or some sort of eatery. Here's a question from one of our attendees. It's from Victory Group, and here's the question for Dr. Hirji. Do I have the right to know if someone at work has been tested positive for COVID-19? Does the employer have the responsibility to be informed about it? Dr. Hirji?
Yeah, I think health privacy is a really important principle, and one that particularly us as, me as a physician, a healthcare provider, holds very dear. And because of that, if someone doesn't consent to release of their health information, it's not something that we can share. And so an employer generally is not, entitled to know if an employee has COVID-19. They can know that an employee is unable to come to work, but that's really the extent of what they would know. However, we in public health would know of any case of COVID-19, and if we were worried about persons in your business or clients of your business being at risk, we would work to make sure that they get informed, and so that information would get out there. Now, I think there's a lot of panic sometimes when individuals find out someone might have had COVID-19 in their business and what the implication is to others. And actually, in many cases, there's actually far fewer people at risk than one might think. And that's really why we do a very detailed investigation in public health to really zero down on who really is at risk and who needs to be isolated and who doesn't need to worry. And if you leave it to us to handle that follow-up, I think we'll make sure that the right information gets out. Just to quickly want to comment on the issue of restaurants. I think there's a lot of focus on our restaurants and bars, but I think the good news is what we see in Niagara is that we don't really see them as being a driver of the spread of infections. There's really only 2 scenarios that we're seeing where infections are spreading because of restaurants and bars. One is at a party actually at the table, the infection spreads amongst them. And so that actually has more to do with individuals and their social circles and who they're interacting with, and infection spreading there. We're not seeing it spreading from one party at one table to other parties or to staff. And the other part, and I think this is where businesses can possibly do something, is we are seeing some cases where someone who has symptoms of infection nonetheless keeps coming to work, and unfortunately that causes some infection to spread amongst the staff working at that business. And so, the big thing I think businesses can focus on is, as Chris was saying, is to focus on screening your employees, making sure your employees don't have any symptoms of illness before they come to work. So I take out the risk of them carrying infection into the workplace. And if you have sick pay policies, things like that, I think that creates an incentive for people to be open about their symptoms and not hide it because they feel the economic pain and they're needing to work to make income. And so I think that's one approach that businesses could take to make restaurants even safer. But for the most part, I think restaurants and bars are doing very well in Niagara.
Yeah, I agree with you on that. And I think your input is greatly valued actually in what employers can do. Here's another question, and this one is from Leslie Harper, and I think it's a really valid question too. And it's asking, would the various levels of government ever look at closing down an individual business versus a whole sector at a time? And I think that's sometimes the pain that we feel. So we hear sometimes in the news, here are a couple of businesses that have maybe not followed all the rules, but because of it, 10,000 businesses need to now close down or be, adapt and change. Dr. Hirji, what are your, or Chris, either one of you, what are your thoughts on that?
Yeah, and Chris, I'll have him weigh in on this a little bit. I think what the province has done in terms of broad closures of business was really about trying to stop that social interaction. And so it's not really about the business per se, it's about the social interaction of the public, and the business is just the way you take away the venue for that social interaction to break it up. I think our hope is that we can stop that social interaction through messaging, through motivating the public, as opposed to forcing a whole sector of business to shut down. I think where we do have a business that is perhaps, flouting the rules, not really taking the precautions, that's when people like Chris and his team of inspectors get involved to try and, at the first stage, try and motivate and encourage them to improve their rules, because most businesses want to be conscientious operators and don't want to break the rules. But on those rare occasions where someone is not compliant, we would proceed to the point of there be a public health order to close down. And I'm not sure if Chris wants to comment a bit more on that.
No, just following your points there, Dr. Hirji, it would be approached on a case-by-case basis. Public health inspectors do report, we're in close contact with the PHNs that are doing case contact management. When there is a high-risk facility or exposure site that's been identified, the public health inspector will follow up and conduct an inspection in order to gauge how appropriate and how thorough the COVID precautions are being adhered to, and in order to ensure that they're in place. So based on the report that occurs, they will report back and we'll have discussions in order to determine how risky is it for that establishment to continue to operate and potentially expose or put people at risk for infection. And then from there, we would decide whether or not we would like to move forward.
Yeah, and that's really helpful, Chris. And there's a question, I think it's directed at you too, Chris, and this is coming from Melinda Chadra. And she's asking, are there any inspectors that go to restaurants and address the issue of manipulating the seating setup? So sometimes we see that people have moved tables together, have had bigger parties because of that. What is the role of inspectors?
Yeah, inspectors will respond to complaints. It's a fine line because a lot of the regulation in the order is being enforced by municipal bylaw enforcement officers, and public health inspectors do have a role in contributing to the potential for infection spread. So if they do see circumstances where individuals have joined tables together, we'll visualize and assess the risk attached to that, particularly around numbers. We are not encouraging large gatherings, large social gatherings. So if it is in excess of 10, we will have a conversation with the owner or operator at the restaurant in order to determine what the situation is and if that could be prevented from occurring in the future or down the road. But we look at everything from cleaning and disinfection, how often they're doing it, particularly the high touch surfaces, as well as whether or not they're gathering the information from the patrons that are coming in, because that can become useful down the road when there's a situation where there's a high risk individual that may have visited the facility or the food premise while they were infectious. And then we look at different items. Are they offering buffets, which are not to occur right now because of passing tongs and multiple people handling those tongs? Are there multi-use items on the tables, such as salt and pepper, ketchup, mustard? That's not the recommendation right now because of the handling in between patrons as well as the method of payment, encouraging a contactless payment as opposed to cash. We're not discouraging cash, but when possible, that contactless payment or online reservations in order to bypass maybe or maintain capacity within the food establishment. So based on what the layout is, they don't have a number of people having an influx into the restaurant where there's wait times. They can sort of manage who's attending at that particular time, as well as is there music playing? Is there dancing? Live bands are not encouraged to be a part of restaurants or bars at this current time too, because the louder it is, or the closer you're in contact with people in terms of when you're dancing, obviously there's more risk for transmission. And talking loudly or singing loudly, that allows you to speak moistly and therefore potentially allow for contact transmission.
Yeah. Dr. Chris, it's very helpful actually. And I think again, we really do have to focus on the details of every single aspect of a business operation that takes place. Internally, when we look at employees, even the way we conduct our work that we do, and then especially when it comes to our customer focus that we have to. Dr. Hirji, this question is from Yvonne, one of our attendees today, and she's asking, what is considered close contact? And what is the length of time that is considered to increase your risk of exposure? There have been different reports recently on this issue, and we would appreciate your expert view on this.
Yeah, it's difficult because there's no hard and fast cutoff for any of these. The greater distance you have between people, the lower the risk is. And we say that once you're 2 meters apart, it's pretty low, but there's research showing that if you're more than 2 meters apart, it becomes lower. And likewise, the amount of time you're in contact with someone, the longer that time is, the risk, of course, increases proportionally to that. The rough rule of thumb that the World Health Organization has suggested in terms of time is about 15 minutes with that 2 meters, less than 2 meters distance. And if you're doing that, you're putting yourself at some risk. But that's really, there's a continuum, and they've kind of drawn this cutoff and say this is lower risk and this is higher risk. But it's not like if you're 14 minutes and 30 seconds, you're somehow massively lower risk. What we do in public health is we really look again at this on a case-by-case basis. After every case, we find out their contacts, we're really assessing it, and we're taking account all of the different situations. Indoors versus outdoors makes a difference. The amount of spacing makes a difference. The time makes a difference. Whether you're wearing a face covering makes a difference. Even the nature of your interaction. Having a conversation is, of course, very different from my personal support work or a close family member, giving you help and, physically assisting you. So all of those things need to be taken into account when we're making that assessment. But roughly, we're looking at if you're staying 2 meters apart, if you're only, interacting for a few minutes, much less than the 15 minutes, you're in most cases not going to be at much greater risk.
And on that same topic, this is one of the questions that had been texted to us, and Dr. Hirji, is probably for you. How dangerous is COVID to a healthy adult? And you're touching on it a little bit right now, but can you give our attendees some sense of that?
Yeah, so I'm just going to put up our website here to show you something in a second. COVID-19 is a coronavirus, and coronaviruses, there's actually 7 other coronaviruses, 4 of which regularly circulate throughout our winter and are one of those viruses that cause the common cold. And so what we see with COVID-19 is we really have the spectrum of, on one end, we have people who really just have a cold, and some people actually don't have any symptoms at all. And to the other end, of course, we get the very severely ill who end up in hospital, on an ICU, potentially on a ventilator. And of course, unfortunately, people unfortunately do pass away from the infection. Just quickly showing you our website here, you can see those numbers at the bottom there showing that 90% of people have basically isolated at home, recovered at home without really needing any kind of medical care. And it's only that other 10% who've been in the hospital or potentially who've been severe enough that they've needed to go into an ICU to get care. So it actually is a relatively small proportion of people. That being said, the proportion does increase as you get into older age groups. And I'm just going to switch here over to this tab of our data website that shows the number of cases and how that breaks down. And so on this page, you can see on the top right, we have the number 68 there that shows the number of deaths. And one of the things about our website is actually interactive. You can click on elements and it's actually going to change the data. So I'm going to click here about long-term care home, retirement home outbreaks. And you can see that actually the data all adjusts, and you can see now 56 deaths were in long-term care home and retirement home outbreaks. And that's obviously giving you a clue that age is probably very highly linked to the severity and likelihood of passing away. I'm just going to scroll down here to where we have this age graph. And I'm going to click on the 80 plus age group. And when we do that, we can see that 54 of our 68 deaths were in people over the age of 80. If I now add in the 60 to 79 age group, you can see 65 of our 68 deaths were people who are over the age of 60. And if we add in the 40 to 59, we actually cover off the rest of our deaths because there are people in their late 50s who accounted for the remainder of those deaths. So, COVID-19 very much seems to be far more severe for an elderly adult, less severe for a younger adult in their middle age, but that's not absolute. There are definitely some middle-aged adults, even people in their 20s and 30s who have ended up in ICUs, have been on a ventilator. Around the world, there have been reports of deaths of people. And of course, people's underlying medical conditions make a difference as well. And so I wouldn't want to say that one is absolutely protected because you're under that age of 60 or the like, but there's definitely some, protection from that. Just going to put up this last graph here showing the fatality rate from different age groups. And this is breaking down to 10-year increments. And you can see it's quite small in these age groups, coming down to about 50 years. And then once you get to the 50 to 60 group, it starts to increase, and you can see it quite rapidly increase into those elder age groups. So it's much less likely that someone young is going to have severe illness, but it does still happen. And so we all want to take those measures to protect ourselves and those around us, and particularly make sure that we're not getting COVID-19 and then passing it on to our parent or our grandparent or an uncle and aunt or an elderly loved one. Because of course, if we keep COVID-19 low across all of us, we protect those most vulnerable amongst us.
And actually, your charts actually are very timely because we got a question from Melinda Chartrat. She's with Conseil Scolaire Catholic Monin-Benir, and she's asking, have there been any cases for students from the ages of 4 to 8 years of age? Do you recommend mandatory masks for this age group in our schools for this region at this time?
Yes. So you very helpfully sent me that question just before we started. So I was able to quickly look up our data. And yeah, we have had COVID-19 cases in that 4 to 8 age group. It's not a large number. It's a small double-digit number of cases, but nonetheless, there have been some cases. We do think that face coverings likely do decrease that risk. So where a child is able to wear the face covering and is able to tolerate it well, we definitely encourage them to wear that face covering. We do recognize, though, that young children may struggle with wearing that face covering. Even just having a child keep it on without pulling it off is going to be difficult. So we're not shooting for perfection here. Do the best you can. If a child is definitely not able to handle it, obviously we don't want to put children to more discomfort. But where they're able to handle it, it's one thing that we can do to help protect them and help them protect everybody around themselves as well.
That's very helpful. Chris, this one is probably for you. It's from Paula Marie Janetta, and she's this Master Installation Commercial General Contractors. And her question is, I would like to engage in a discussion regarding the use of masks for site construction workers who are performing vigorously exerting physical work, such as on a ladder while erecting staging equipment. If a worker indicates that wearing a mask is a health and safety concern, i.e. possible work refusal, what is the responsibility from an employer perspective? And over to you.
Thank you. I think based on the situation that you outlined, the Occupational Health and Safety Act would be the prime area that would lead or direct you to where you need to go. What I would do in addition to reviewing that is to connect with the Ministry of Labor, Training and Skills Development, to inquire further in terms of how to handle that situation.
Yeah, I think that is helpful. And we can also follow up with her directly and providing some of those links. Dr. Hirji, is there any legitimacy at all to the common claims of anti-maskers?
Yeah, the anti-maskers, I think similar to people who are opposed to vaccination, often get a very loud voice, perhaps disproportionate to their actual numbers, because my observation is the vast majority of the public is wearing their face coverings. I'm not sure any of us particularly like it, but we all understand it's something important. It's something that we have to do. What I do find with the people who are opposed to face coverings is that there's sometimes a little bit of kernel of truth of what they're saying, but then they've sort of overstated it and applied it much more broadly than it really is. So, for example, one of the claims they'll often make is that, it makes it difficult for people to breathe and it could actually be harmful as a result of that. It definitely does make it a bit more difficult to breathe. I know that, when I wear a face covering and I'm running up a couple of flights of stairs, I feel a bit more winded. But for everyday activity, it should not really be an impact on most people. there's going to be some people who do have an underlying medical condition where it's going to be a danger for them, and their healthcare provider will give them that advice that they shouldn't wear a face covering, or if someone's wearing a face covering that's actually feeling that they're struggling to breathe, they absolutely should be taking it off at that point. But for the rest of us who are able to wear it and it's not terribly comfortable, but we're not necessarily having trouble with it, we should continue to wear it. Another thing that they've talked about is, face coverings aren't effective. They're not actually going to stop the spread of COVID-19. The research on this is, I think, not as clear black and white as ideally we would like it. And so there is some kernel of truth there that, we don't know absolutely certain how effective face coverings are. But through the past 7-8 months when the world has been living with COVID-19, basically most studies have shown that there is some impact that face coverings are providing in slowing the spread of infection. We can't say with absolute certainty, we don't have the strength of research we'd ideally like, but the consistency of it does lend it some credibility. And of course, with all of the economic pain and some of the social pain people are experiencing, it does seem like a relatively small price for us to pay to hopefully relieve some of that by just wearing our face coverings and making it easier on everybody else.
Yeah. And I think then there's probably likely also the question what type of face coverings people are using at the same time. Do you want to touch on that a little bit?
Yeah, I think one of the challenges here again is that the research is so new that we don't have a lot of research on what type of face covering is necessarily better than others. Yeah. One thing I can say quite certainly is N95 respirators or those really high-end masks, that's not going to really give you any additional protection. So it's not a good use of your money, and it's actually taking it away from our healthcare providers who really need it. Medical masks, I think that's the baseline protection that people in our hospitals and healthcare facilities use, and that's certainly an appropriate level for the public at large. I personally choose not to wear the medical mask because I want to make sure that we don't use up the stock of it and it's available for our healthcare providers. In the spring, we were definitely running low on it, and some of our long-term care homes, for example, were struggling to have enough masks when they were dealing with outbreaks, and I don't want to be contributing to that. So I choose to wear a reusable cloth mask. Lots and lots of different kinds of cloth masks. It's obviously not something that is standardized. I think if you're wearing any sort of cloth mask, it's going to have some benefit, and it's really about how much more of that marginal benefit you want to use a better one. Some of the things that I would look out for is that if you're wearing a cloth mask, look for one that's 2 layers as opposed to 1 layer. It's kind of like you have, 2 layers of Swiss cheese together. Those holes are not going to hopefully align, and so you're going to decrease the ability of droplets or virus getting through it a little bit more. And the other thing I look for is that, is there a little bit of that metal, bar underneath the top of the mask? And that's really important, that it allows you to kind of mold the mask around your face so you don't have space there where air and viruses can get in or out. And for me, as someone who wears glasses, it's also very useful that if I have that seal there, when I'm breathing, it's not coming up and fogging up my glasses. So those would be the couple things I'd look out for in whatever mask you're looking for, that 2 layers of material rather than just 1 layer is going to give you a bit better protection. And look for that little metal underneath the top of it so you can mold it around your face and make a good seal.
Okay. And I think there's more questions coming in on that, on our face coverings. And Chris, this one is for you. Should a customer-facing business require employees to wear masks at all times? Is a physical barrier like a plexi screen an acceptable substitute for a mask?
The original bylaw does say that customer-facing businesses need to have staff members wear a face covering or a mask. So absolutely, that is something that we need to visualize and we need to see, and it should be encouraged by owners and operators of businesses throughout the Niagara region. When taking a look at perspex or any acrylic plexiglass, it can act as a substitute, provided that it's constructed physically in a manner that would accommodate a number of different factors. The National Collaborating Center for Environmental Health has provided a little bit of guidance when constructing these plexiglass barriers. And what they need to do is they need to accommodate at least 30 centimeters in radius from the central point of your eyes or your ears around your head, and has to accommodate the smallest and the tallest worker within your business, as well as be adequate to cover off the breathing zone for a typical individual. And that the opening that will allow you to conduct business needs to be small enough to prevent any potential spread of infection through coughing, sneezing, etc. So make that hole just large enough to allow you to conduct your business, as opposed to going over the top and allowing for that sort of exchange if it is potentially in use.
And Chris, while we're looking at some of the details, this is a question that has come forward too. How and how often should a business disinfect surfaces?
That's a very good question, and it's critically important because it's one of the items that the public health inspectors are checking for when they do their follow-up. They will go into businesses as well that we aren't commonly in. When I say commonly in, we are mandated to conduct inspections of food premises, as an example, or what we call personal service settings like nail salons, barbershops, tattoo parlors. But we are going into non-traditional businesses at this point, and a lot of the conversation revolves around, is the cleaning and disinfection adequate? And I think it starts first and foremost with knowing what product you're using, being very familiar with that product, looking at the manufacturer's instructions for use. Sometimes that'll tell you if a PPE is required when using the product, but also making sure that it's approved for use in Canada. All chemicals, disinfectants, or cleaners need to be approved by Health Canada to be used in Canada. And when looking at a disinfectant, you have to look for some key identifiers. A DIN number or an MPN number gives you the confidence that it's been passed through Health Canada's rigorous process and it's allowed to be used for disinfection processes or disinfection purposes. So when cleaning and disinfecting your environment, you always want to make sure there's a cleaning step prior to disinfection. You want to remove that organic matter prior to the disinfection. I know on the market that there are some wipes available that are a 2-in-1 or a cleaner disinfector. Those are adequate, provided that the contact time is met. So on the manufacturer's instructions for use, it will say that the surface needs to remain moist for 5 minutes, 10 minutes, depending on the type of product that you do choose. So make sure that that is followed, because that'll allow for the appropriate kill of the virus or the bacterial load that may be on those high touch surfaces. So on top of your daily cleaning routine and logging and record keeping the cleaning to make people accountable for that practice, what we do recommend is that all high touch surfaces are cleaned and disinfected at a minimum twice daily, but even more so if necessary or if it's at all possible. Especially if you see surfaces grossly contaminated, those need to be cleaned and disinfected. So some of the high touch surfaces would be door handles, light switches, bathroom taps, railings, elevator buttons. Key in specifically on those items, because a whole host of people are touching those items on a day-to-day basis and throughout the day. And those would be higher risk type of surfaces that you need to consider. And the last point I would recommend is to make sure that you're using a product that is within its expiry. Using expired products will create issues down the road because they'll lose their capacity to disinfect and kill the viruses that are responsible for transmission of disease.
Thank you so very much. Dr. Hirji, we have a question here. With cold and flu season upon us, is there a way to differentiate from a common cold and COVID? Should everyone showing symptoms of a cold get tested?
Yeah, so it's very difficult to tell a cold from or flu apart from COVID-19. You know, some of the things that seem to occur with COVID-19 that are a little less rare in colds and flus would be losing taste or smell, or seeing your taste or smell change. It does happen with colds sometimes. It happens a lot more often with COVID-19, it seems. COVID-19 often seems to be more about sore throats, runny noses, nasal congestion, which is a bit different in influenza, where there's going to be much more coughing and muscle aches. But that, you know, COVID-19 presentation can be very similar to a cold. So it's really hard to tell apart. My advice is that this year, if you are getting those mild symptoms of illness like a cold, I really would encourage people to go and get tested, just so you know for sure it's not COVID-19. One of the things that if you get tested for COVID-19 and we find out it is COVID-19, it does enable us in public health to figure out where you might have got the infection from, figure out who your contacts are and where the infection might be going, and really to manage that and hopefully stop that entire chain of infection. One of the things we've unfortunately seen is that people are getting, you know, the runny noses or a sore throat, and they're disregarding it as a cold. And then after it's lingered around for a week, they finally decide to go get tested. And unfortunately, it turns out to be COVID-19. And that unfortunately means that they've spent a week going out and about their activities, going to work, and unfortunately infection is spread. And that's one of the reasons why we're seeing the numbers of infections higher in Niagara right now. And so I really encourage everybody to pay very close attention to your health. Don't ignore those mild symptoms like a runny nose or some congestion or a sore throat. Stay home if that happens, isolate yourself, get tested, find out if it's COVID-19. If it's not COVID-19, that's great. But if it is, hopefully all will go well, because for many people, it really just has the course of a cold, but we'll be able to make sure it doesn't spread to anybody who is really vulnerable.
And Dr. Hirji, on the same note of it, we've recently seen reports from the CDC that COVID is airborne, meaning it can spread between people spaced more than 2 meters apart. How much of a threat is transmission by this method, and what can we do to stay safe?
Yeah, this is, I think, a very complicated and somewhat controversial issue. When an infection spreads, it can spread by respiratory droplets, which occur when we're coughing or sneezing, but even when talking. And the idea is those droplets will kind of fly out, but they're kind of heavy, and so they fall down after a meter and a half, 2 meters, which is why we say keep that 2 meters distance, because that puts you out of the range of most of those droplets. The idea of airborne spread is that you're not really emitting droplets, you're more letting out basically aerosols, which will hover in the air and stay on for hours. We know this happens with COVID-19 with certain kinds of medical procedures. We're not really seeing it for the most part with the public at large. Infection doesn't really seem to spread that way. And even the pattern of spread we see with COVID-19, it doesn't really seem like it's truly that kind of airborne spread. Otherwise, we'd be seeing far, far more people getting infections. We would, one person would be inspecting 20 or 30 people because that aerosol would linger in a room and everybody in that room would get it. Likewise, in our healthcare facilities, Niagara Health has a ward dedicated to COVID patients, and they're not wearing the personal protective equipment to stop airborne spread. Yet, their healthcare providers are staying safe and not getting COVID-19, using just the spread to stop those droplets that are heavier and fall down. I think where the confusion arises and some of this conversation arises, of course, saying there's droplets and saying there's aerosols or airborne aerosols, that's kind of creating a dichotomy, but there's this gray area in between where you're transitioning from those heavy droplets and moving closer to aerosols, but not maybe quite there. So there's some fine droplets that maybe stay in the air a little bit longer, don't fall quite at 2 meters, go a little bit longer. It's really still debated in the research how big an issue it is. What we can say is that it's rare that transmission of infection occurs this way. There are a few cases though it looks like it perhaps has done. A lot of the research here is also very theoretical, where it's lab-based research that they detected that the virus is in that, but is it enough to cause infection? The number of true infections caused by that is relatively low. My perspective on this is, of course, we can't achieve perfection. There's no zero risk scenario. I think people who are business owners understand that you can't manage every risk to zero. You're trying to manage the big risks and get them as low as reasonably possible. And then hopefully you'll be okay with what remaining risk there is. And so what I'd really encourage is trying to focus on what is the big driver. 95+% of spread is going to be from those big droplets. And so screening employees for sickness, keeping 2 meters distance, wearing face coverings, doing all that disinfection that Chris has talked about, washing your hands, sanitizing your hands often, that's probably going to get you to 99% of the risk is gone. There's going to be that small residual risk from those transition between droplets to aerosols that's going to linger in the air and perhaps occasionally cause infection. I think if we improve ventilation, do things outdoors, that actually gets rid of that risk as well. But I don't think we should go too hard on focusing on that minority of risk. We should focus on where the majority of risk is, because that's going to get us our biggest bang for the buck.
Well, on that note, this week, the report came out about our four-legged friends, a dog that tested positive. And give us your take on that part of it, and if it should change any of our habits and relationships and others that we have with our furry friends.
Yeah, this is another topic that I think has gotten a lot of attention. And I think fortunately the story is very similar here. in that we've never actually seen dogs pass on infection to a human. It's gone from humans to dogs, but not from dogs to humans. Now, we can't say it never occurs. Maybe we've just never found those few examples where it occurs. But what we can be pretty sure is it's pretty rare it occurs. And so again, not really focusing too much on these small, very rare cases of maybe where infection might spread, and keeping our focus on those big things is really where we want to stay. If you do have a pet is showing symptoms of illness, you may want to take them to a vet to find out about that. Probably you want to always be doing, good hand hygiene, using hand sanitizer, or washing your hands after you interact with a dog, just in case they could have any sorts of infections or other, parasites or the like. And obviously COVID-19 is just one more thing you want to protect yourself from. And likewise, if unfortunately your family gets COVID-19, maybe you want to make sure those who have infection stay away from the dog so they don't pass the infection on to the dog. So some, minor things that we could probably always be doing: hand sanitizing, keeping your distance from the dog if people are sick with infection, but otherwise not really focusing too much on that and really keeping the focus on the big stuff that does lead to spread of infection.
Yeah. Chris, this is a question that has come forward. Again, we're talking about a lot of recent reports and this recent report suggests that COVID can remain infectious on banknotes for up to 28 days. What are your thoughts on this one, and any extra precaution that businesses or individuals should take?
I think first and foremost, in dealing with this situation, we always have to be cognizant of hand hygiene, hand washing, ABHR, alcohol-based hand rub, making sure that they're at key points. So after handling money, you could do that hand hygiene in a very timely manner. I've seen a number of staff utilize ABHR that are attached to their belts for a quick squirt and then a hand rub. But at the end of the day, if you're practicing appropriate hand hygiene, you're not touching your face, the handling of cash the risk should be minimal. I would encourage or promote the contactless payment, but cash is something that will continue to be used for businesses. And I would say even when it comes down to coins, there is research or literature that supports that the virus can live on copper for 4 hours and any steel for 2 to 3 days. So always remembering hand hygiene and not touching your face will go a long way to preventing potential infection.
Yeah, I appreciate it. I'm conscious of the time that we have, but Dr. Hirji, I was wondering if we can get one more question in. We've kind of touched on it today, but does a business have a right to refuse service to a customer who will not wear a mask, even if they claim a medical exemption, and should they? If they did not, would they be liable under the OHSA if that customer ended up infecting employees?
Yeah, so some of this is really more legal questions around occupational health, and I don't really have the expertise to provide an answer to that. So I'm not really going to answer that part. What I will say is that the provincial regulation requiring face coverings, which really is the governing rule now, it's superseded our regional bylaw and the St. Catharines bylaw. That does allow for people who have a medical condition not to wear a face covering. And I would personally feel that we should support that exemption. There are legitimate people who are going to have medical reasons where face covering is going to be difficult for them, and we don't want to stigmatize those individuals. We want to make sure that they remain part of our community. We've talked a lot about Niagara together, and we're all in this together. And I think part of that is that we show understanding. We don't stigmatize those around our community who maybe aren't able to wear a face covering, and we continue to try and serve them and support them. I think face coverings, again, aren't going to, there aren't the difference between getting COVID-19 or not in most cases. They're an incremental measure that gives us an additional bit of protection. They're not the whole way. And so as long as we're putting all of those measures in place, keeping people with symptoms out of our workplace, ensuring physical distancing, the face covering is a little incremental measure that allows us to be even safer, but there should still be lots of other things that person who can't wear a face covering can do to make sure they're keeping everybody safe in the business.
I appreciate it. Conscious of time, gentlemen, where can people go to find more information that they might need? What are the best places to go?
Yeah, so, first stop I'd suggest would be our own website, niagararegion.ca/COVID-19 without the hyphen. That'll take you right to our page in public health where you can find the link to statistics, link to information, but also a link that actually has to do with economic recovery and some of the restrictions on businesses, which I think would be quite helpful. The other place that I'd suggest is going to the Ontario website, and I believe it's covid19.ontario.ca will take you directly there. I might have that slightly wrong, but they have lots and lots of resources on what businesses should do. There's, whole guidance documents providing advice for different sectors on what are some of the precautions to take. And of course, they'll have links to those regulations which show the actual rules that absolutely need to be followed. So those will be the two go-to resources I'd suggest, our website and Ontario government website.
And Chris?
Sorry, just to chime in, I would also encourage all businesses to reach out to their area public health inspector. It would be incredible to be aware of the situation that the business operators are going through and get the input of the public health inspectors. We also have a duty officer line. So if you call 905-688-3762 or 905-688-8248, extension 7590, we have 4 public health inspectors that are taking calls throughout the day and providing guidance and support to the community at large.
Yeah, I really appreciate it. I appreciate that both of you were able to join us for this past hour. Dr. Hirji and Chris, thank you so very much for your insight and expertise when it comes to this. Hopefully we can stay in the stage that we're in right now and even get better numbers and don't have to roll back to stage 2. So thank you for that. And my thanks also go to TD for partnering with us and making this webinar possible this morning. This webinar has been recorded and will be available on our website, as well as it will be emailed to all participants who've been with us today. And to all attendees, thank you so very much. Your questions have been coming in throughout the hour, and we tried our best, hopefully, to address most of them. For a complete list of some of the websites that have been suggested in resources, those will be emailed, and we'll also make them available on our site at gncc.ca. Wishing all of you a wonderful Tuesday. Thank you.